turn to questions. Jennifer.
Yeah, so if you are here in the room, if you have a question, please go to one of the mics on either side of the room to ask your question, or if you're listening via web and you want to submit a question, again, go to the Q&A text box to type in your question and click on the submission button below the player. And it looks like we're waiting for some questions to come in. We don't have any in the room.
I see one.
Oh, you see one?
Right. Yeah, you can go back to that mic.
I think they were just turning it on.
Oh.
Okay, well, I will, to kind of get the discussion started, oh, we have a question right here.
Hi, thank you very much for your discussion. I'm just wondering, with regard to child fatalities, what your report had to say.
I'm sorry, can you identify yourself and your organization?
I'm sorry, I'm Kristen Krizwanski with the National District Attorneys Association and the National Center for Prosecution of Child Abuse. We do a lot of work with the National Coalition to End Child Abuse Deaths. Thank you.
Yeah, go ahead, Joe.
Thanks, Kristen, for your question. As we were looking at both the data about the prevalence of child abuse and neglect, certainly one of the things we looked at was what the reports are in terms of child abuse and neglect fatalities and what those rates are, and the fact that like with other forms of child abuse and neglect, the actual reports we believe to be underreported. And also, as you can see in our report, that we've looked at some of the research that has been done of comparing birth and death records with child abuse and neglect reports, as well as emergency room admissions and other kinds of things, just to say that's where a lot of our recommendations about needing to look at multiple sources of data and not just the reports of the actual reports to child abuse and neglect are really important. So that was something that is definitely covered in our report.
We have another question down here. You can please bring the mic forward. Thank you.
Hi, I'm Rosemary Chalk. I'm a consultant with the Doris Duke Charitable Foundation. I want to compliment the committee on a very ambitious, far-reaching report. I'm very intrigued by the statistical data that you were citing, that you're referring on the number of referrals to the child welfare system rather than substantiated cases. And I'm curious if you could elaborate on that as to why you chose that data point as your main statistic. And there is so much effort and resources invested in the investigation process in terms of the substantiation versus how to handle the differential response. Is the panel saying, as you call for a broader public health response, that we need to look at this phenomenon in a different way, sort of not through the adjudication process, but rather through a population-based approach that would not focus on individual specific incidents, but rather a whole community response?
I think you answered your own question.
Being an expert herself.
Could you elaborate on this, why you chose that point as your statistical?
We didn't actually, so if it came across that way, we're sorry for being misleading, because the report, I think, includes all of those issues in various systems. In calling for a national surveillance system, what we're saying is it's very important to have the data, and we know that there's a report recommending a surveillance system with guidelines for doing this in local health centers, but it's very important to include all the data and then begin to figure out what they mean. And what the research literature reflects, as you know well, is that a lot of cases are not substantiated in the Child Protective Services data, but then other research suggests that there is a great deal of underreporting, things missed in that system but included in others, and we just need for the nation to have good information on this problem, we need to have all the data together and then learn what it means.
I think, you know, as Ann said, there is a lot more statistics in the report that we look at more comprehensively. But I do think that one of the issues was that every state kind of has a little bit of a different definition of what they use, what encompasses neglect. And so the issues of reports was sort of one place, but what gets screened in and out is, you know, different across different states. So we really, I think one of the things we really highlight in our report is the difficulty and really wanting to try to make some recommendations so that we could have a better national understanding at that population level.
Is there another question from the audience, or is there another follow-up?
I was just going to say, there is a lot of discussion of all these issues in the report. So those of you who are really interested in this difficult, complex question, we urge you to take a look, and or somebody at the Academy will hear all of your responses.
Hi, I'm Deborah Whitcomb. I'm with the Office for Victims of Crime in the Department of Justice. And I wanted to ask about the concept of polyvictimization and how that is reflected in your report. The ACE study and the National Survey of Children Exposed to Violence both tell us that so many of these children actually experience many, many types of maltreatment in their homes and, of course, in their communities as well. And I'm wondering how you capture that at the same time as we're saying that child sexual abuse has declined, physical abuse appears to be declining, but yet there are so many children who are experiencing various combinations and permutations of all the different forms of violence.
Yeah.
That's a great point. And I think that what the report conveys is consistent with what you would expect, and that is that the more different kinds of adverse experiences the child has, the more likely the child is, so it's a probabilistic model to some extent, that the more likely the child is to experience challenges in coping. The ACEs study is certainly compelling with regard to that, but so are other studies. In terms of, I'm not sure that we address that issue of, and I hear you, that are you raising concerns that the decrease in sexual abuse and physical abuse might overshadow the concerns about polyvictimization? Are you raising that issue?
Not really. It's just, again, trying to get this understanding of what the children's experiences are by separating those things out, and especially given the complications of the different definitions across the states and all of that,
Yep.
that we lose, I think, the big picture of what happens to many of these children.
That's actually a significant recommendation for the future, is that we continue to try to take apart these various experiences, because we do know that the more problematic things that happen to a child, the more likely problematic outcomes. But taking apart the effects of abuse and neglect is one of our primary recommendations for the future.
But as you mentioned, many children are polyvictimized. And as we heard, neglect is a major piece of that. About 3/4 of the kids are neglected. And emotional abuse, usually if you are neglected, physically abused or sexually abused, emotional abuse is connected to that. So indeed, and we had a lot of discussion about that, about the fact that these children really have multiple abuse, tend to be very chronic, and then the impact and the consequences of those combinations.
We have a question from the web. Have you considered utilizing children's advocacy centers as partners in multidisciplinary research projects, as there are more than 800 nationwide that are already involved in care and multidisciplinary response to child abuse?
We did
Yeah,
include mention of child advocacy centers and their role as a sort of an example of service delivery with that are included in our research infrastructure chapter, I believe.
In general, in our systemic approach to looking at this problem, we see the key importance of all community resources, including child advocacy centers, because that's where the sustainability of response is going to be made. And so it's critical to really see all of the important stakeholders being a part of the solutions.
I believe we have another question from the audience.
Hi, my name is Mary Lou Randor. I'm a psychologist by training, and I work at the Animal Welfare Institute, and I'm also chair of a section on human-animal interaction in the American Psychological Association. So you probably have guessed that I'm going to say something about animals. Related to polyvictimization and also the screening process, there is, I think, now credible empirical evidence over time. It's a very close link between animal abuse and child abuse, and that one of the first opportunities for identifying a child at risk may be from your animal control officer who went to the house on another report and was trained to look around or a teacher. I could go on and on about it, and I won't, but my question is, in this larger picture that the other person is referring to, is the idea of community and ecological system, can it include asking screening questions about pets in the home, witnessing violence toward animals, whether it's dogfighting in your community, et cetera?
Mm-hmm. Thank you. You raise a really key issue that we were just talking about recently. I'm guessing that the committee did not adequately cover this broad area, but we recognize that as community solutions, it's also important to look to the human-animal interaction area for solutions as well. So it would certainly be one of those things to be addressed in future research. Yeah.
I just wanted to add that one of your committee members, Howard Davidson, who's a colleague of mine, he and I wrote a booklet on child abuse and animal abuse that tried to identify, why it was important in the different laws that might pertain to it in both the child neglect area. And those brochures as a booklet are available if anybody's interested.
Right. Yes, I know it was surfaced in the committee discussions. Thank you.
And we have another question from the web. This person writes, I agree that well-being has suffered from the emphasis on safety and permanency. Do we have adequate well-being measures for this population of children?
Yeah, you want to take it?
Well-being is recognized as a really critical issue by the committee. And there are, in the consequences chapter, there's certainly various aspects of development in the well-being domain rather than the permanency and safety domains. And so I think from the committee's perspective, that's the way we addressed this issue, was looking at attachment, for example, self-regulatory issues, et cetera, that are really well-being variables rather than safety and permanency dimensions.
I think also we looked at some of the interventions or sort of treatments like cognitive behavioral therapy that helps improves people's sense of well-being, but I think those are some, once again, areas for further study because a lot of this work is much newer.
But you're certainly right in terms of what the committee did there is look at outcomes of those interventions in areas of well-being, probably more so than really safety and permanency.
And I just want to add that some of the discussion was about the impact of abuse in terms of physical health and mental health, and the need for a really multidisciplinary approach to meeting the needs of the child for their development and well-being.
I have another question from the web. African Americans are disproportionately represented at multiple points of contact with the child welfare system and other social systems. Much child abuse and neglect research focuses on characteristics of African American youth and families. But what about research geared towards studying those in positions of power who are making the decisions of youth and families' lives?
Thank you. A very important issue, and this was the reason for the cross-cutting issue to move away from looking solely at race, but to look at the set of factors that really are things that can be studied and can be engaged in interventions. There is quite a lot of research, not so much related to child abuse and neglect, but looking at the effects of stereotyping and related areas, and we just felt strongly that this needs to be integrated into child maltreatment research, and it is not now enough present. The recognition of the point being made by the participant on the web is not enough integrated into the current research to even be able to say much about why that observation is occurring. So we really hope that over the next 20 years, the research will look different and we'll understand better what's going on with this over engagement with the Child Protective Services system.
Also, in the report, that's why we really stress needing to look at sort of organizational factors and systemic factors in terms of service delivery and how how services are provided and who, what the training is of workers, and all of those things are things that really need to be addressed.
Thank you, and I think we have another question from the
Yeah,
audience.
Rosemary Chalk again with the Doris Duke Charitable Foundation. You mentioned a strong sense of optimism about the emergence of effective interventions, either to treat families that have already experienced abuse or preventive interventions. And I want to just press you to elaborate on that a little bit more about what are the key interventions that you really see as being most promising. And given your earlier comments about the need for early intervention in a population-based approach, you highlight the risk factors of substance abuse, depression, history of abuse, and yet families often don't qualify for interventions until they've had a demonstrated incident, you know, that a case has been adjudicated, and then they qualify for services. How do you see these services, these effective services, coming into place at an earlier stage for families who present with substance abuse, depression, history of abuse, but may not yet be involved with the child welfare or child protective service system?
One of the interventions that we discussed was home visitation, like the nurse-family partnership that, as you know, and as discussed in the report, has research supporting that it has sort of positive outcomes on the family that undergo that. And as you know, the intervention starts during pregnancy, early childhood, and in some studies, it has been shown to also work to prevent child abuse and neglect. And having the people in the home and the families, certain things can be observed and identified. I don't know if you want to add.
I think you answered well. It is an important point, and I'm really trying to make sure that this is in the report. That a a system for identifying children prior to their involvement with the child welfare system is critical for prevention. And as Angela just mentioned, there are a number of those sorts of preventative programs, that being just one of them. I think we wouldn't want to champion any single program because there are a number of programs that really have been shown to be effective, whether or not, not necessarily with all in changing the incidence of maltreatment, but certainly in enhancing parenting outcomes and enhancing child outcomes. So there are a number of those preventative programs that, and figuring out how to catch children before families get to the child welfare system is, I guess that's not a committee recommendation, but that's certainly a next step that will be important.
I want to add, though, that we do recognize the slippery slope there between early identification and stereotyping. And so we know the risk factors. I think our approach to it, and I'm quite sure this is in our discussions, findings, conclusions, that it's important that all the fields that work with children who might be abused are aware in engaging families of what could be going on. Some states are recognizing this. This is one of the factors we know are involved with rates, differential rates between states. Then in some states, for example, if children are in a home where drugs are being created, the children are likely to be identified as neglected. So we know that there is some recognition in at least some states about these things, but how you go at, I mean, the services approach is one way to make sure that you're not overlooking children in need, but directly going after parents who had been abused as children, drug users, or depressed parents would, you know, the false positive rate could be too high and inappropriate. So it's a matter of having an effective, nuanced system that can really be respectful of individuals and their families, and not, but while also providing them with what is needed. And these are tough times for that on all fronts. So if anyone has good solutions for that, I think it's very important to get engaged in these discussions.
We have another question from an audience member down front.
Yeah, it's not done here.
Hi, I'm Karen Kaplan. I'm with Child Welfare Innovations. Going on with your point, Ann, I was wondering if the committee took a position about universal interventions. More and more what we're finding is that most families have some sort of needs, and it really is a continuum that we can't always track. When do you trip the line? And so after having numerous conversations with some colleagues in the field, one of the common themes that came up was the fact that what we need is more universality in the way that we intervene. And I recognize that that's not easy in a country like ours, but I also recognize that if we're going to get kids off to a good start, that is often what is required. And I just wondered if you had anything to say about universal interventions in your report.
I think we all recognize that, and there certainly was discussion of it among the committee. It does get tricky in our society. We do have some things that approach universality, like pre-K education. We talked a lot about health care. So there are a lot of systems that could really help address this issue. But for the reasons that you hint at, we did not, the committee chose not to make recommendations that would likely be reactive. So we really urge looking at this, and ultimately in this country it's probably going to come down to community choice. So some will do it, and we hope that can then get lifted up if they're effective. But thank you for your question, suggestion.
I have another that's fairly concrete. I almost regret asking it, but you talked at the very beginning of your presentation about 5 commission papers. If you could say a little bit more about what the papers were on and how we can get access to it.
I think that those, I can't answer that, but I think somebody from staff could. I believe they're not available. They were used by the committee in our report.
Quite a number of the content is actually in the report. So they were.
So it was generated.
It was
for the
added.
committee's use.
Yes.
Thank you.
Yeah, yeah.
Well, it looks like we are at the top of the hour, so that concludes this morning's briefing. Again, a big thank you to all who watched us on the web and are here in this room. And again, a big thank you to the committee members who came out today. I don't know if I mentioned this at the beginning, but they all serve pro bono on our committees, so it's a lot of dedicated time that they gave to this study. Thank you again, and just a reminder that you can download the full report and related materials at www.nas.edu and www.iom.edu. Thank you.
Thank you.